Hello and welcome to Health Talk. I'm Cedric, the host of the program, and today in our studio we have with us Dr. Amarnath Sowlee, an orthopedic surgeon with more than 40 years of experience under his belt. Welcome, doctor. It's a pleasure having you here with us.
Yeah, it's a pleasure for me also. Thank you.
We hope to hear more about orthopedic health from you, doctor. I think I'll start with a question just to get the ball rolling. So how does orthopedic health start? Where should we all start with the concern for that musculoskeletal system of us?
See, the word orthopedics means straightening of the bones. In olden days, there were all children, some bent legs and bent arms, for which they used to straighten it. And some bent spine and all, they used to dig the beach sand, put them inside and then bury them. And then after 10 or 15 minutes, take it up. Everywhere there was an exercise going on. Then that was stopped and physiotherapy was started. That went on for exercise and all that bent bones were made straight, putting plasters, gradual correction. So orthopedics means straightening of the bones. That's the main meaning, started there. And before, in olden days itself, there were all indigenous treatments which was going on. But that slowly people started coming, because they just, after the advent of the x-rays, it was more useful to see how it was going on and how people, we see that and detected what is the degree of bend and how much we correct, because the overcorrection can disturb the neurovascular bundle, blood vessels and nerves. So that will cause more deformity. To prevent that, x-rays, after seeing the x-rays and degrees and more, nowadays after the C-arm coming, has given a great help to our orthopedic department. That helps us to do a better job and treating to more or less some accuracy has come along.
Okay, that's nice to hear the doctor. I have a question actually. How does proper gait and posture work with your orthopedics? Does that play a role, as they all say, proper posture and gait?
Yeah, the gait is very important because no one would like to have a bend walk. They'll have to be like erect. You have seen Vivekananda. He'll have his neck erect and chest in the front. As the NCC candidates, chest in the front and bottom, because I was in the NCC, I know that. Okay. So you should be brave, and that shows the manliness and braveness. So any bent bone, as the age progresses, because of the decrease in the calcium, there are three ways. There's three metabolic things going on. In a younger age, they never get bent because the deposition of the calcium and the removal of the calcium is there. The deposition is more than what is being removed. That is anabolism and catabolism. So osteoblastic act, that is a cell, bone cell, which produces the bone. Osteoclast, that destroys the bone. So that process goes on till we die. As the age goes on, the deposition of the bones gradually decreases. And in middle age, they will be finding it a bit difficult. In old age, the destruction of the bone is more. So as a result of which, slowly they become weak, the calcium goes down, and you can see the first sign is the bending of the spine. They'll have a goon-like structure in elderly people. Why the goon comes is because the bone is weak and it's bent up and it's not able to stand on the stress of the body. So that goes on. So that is how it goes on. That's why we try to correct the osteoblastic activity should be more. We put them on calcium, anabolic steroids, and exercise will keep you fit.
Okay,
that is how it goes on.
So doctor, every day morning we see school students lugging around heavy bags. So how does it affect their kyphosis and lordosis?
Yeah, that can increase. Suppose your muscles are weak, the bone will be slightly in the bending tendency, and you overload it with your bag and books and other things. That causes more harm unless you're strong enough and your protein diet is good and you do exercises. That should be stopped. What I will advise for the government, other things are, you store the books in the school. Every day period that should be given. That should be better than asking them to carry on so much of books and seeing that weaken them. So when you come home, you should be relaxed. That should be the system, not overloading them with homeworks and doing this and all. That should not be there. Only then the child will be happy. He'll be feeling good and more. The knowledge will grow more. Where the mind is without fear and is held high, as our Rabindranath Tagore has said, that should be maintained. That's what
Is there any exercises that these kids could follow with respect to bags?
Yeah, what you have to lie down and do the spinal exercises. There are so many spinal exercises which can make your bent bone straight also. So what you have to do is just lie down straight, lift up your leg first till the hip goes straight leg, without bending the knee. Count till 10, bring it down, then the other leg. So that strengthens your spinal muscles. That is the best exercise. And squatting, sitting and squatting helps a lot. Those things will strengthen your muscles. Muscle strengthen will help the bone strength. That goes on like that.
And speaking of our spine is not normally straight. It is bent in two places.
Yes.
Is there any proper sleeping postures? Because a very common one that my peers follow these days is lying on their backs or on the fronts.
No, there is no specific posture. Whichever way you feel comfortable, you can lie down straight, sideways. That's all. There is no specific postures to lie down or anything.
Sitting upright, lying down on your sides.
Sitting upright is very important. The spine will be in the same natural form. There is a bend there at cervical level, there is a bend. Then dorsal, lumbar level, there is lordosis. All that should be maintained only when you sit erect.
Understood, doctor. And what about surgeries, doctor, for plate replacement? What are your thoughts on that? Is that good for your bone health as it is?
See, that is from there are so many, from congenital, right from the younger days, there will be deformed bone, other things that can produce scoliosis, kyphosis. Kyphosis is anteroposterior bending. Scoliosis is sideways bending. That can be corrected. Now what we do is, it has been there, we will keep a rod on the concave side, this side, and distract it. And the other side, on the convex side, you compress it so that it will straighten. And those parts which is not coming, then small bits of bones will remove it, and we will put some grafts. And where the fractured bone, even the fractured bone can cause you a gibbous bending.
Okay.
So that fractured bone, what we now do nowadays is, we will just necessary, if porotic bone, elderly people fall down, they will have a porotic thing, bending more kyphus, they will find it very difficult. The more you get bent, it will give a pressure on the nerves in the spine or in the cord itself, can cause sciatica, radiating pains. So to prevent that, what we do nowadays is, we will inject bone cement. So that will consolidate and straighten the bone, height will come, the pain will come down.
Okay.
Microfractures can be controlled with this.
So with regards to plates, I've heard of titanium plates.
Yes,
ceramic plates have been starting to show up few times these days. So which is a good thing, doctor?
So we have been using titanium right and left. That is best thing because it doesn't have the magnetic effect. You want to take an MRI after sometimes and see, a titanic plate will be better. So it doesn't attract the magnetic waves. But whereas you put an ordinary plate, you can't take with an ordinary plate inside, you cannot take an MRI. It's scattered out the thing, and sometimes the grafts, the implant kept inside can also come out. So much power is there in the MRI, magnetic resonance thing, imaging thing. So we advise most of the people who can afford, titanium is better. Only thing, it's a bit costly. The prices should be brought down so that it can be feasible for all the poor patients also. Because in the government hospital, we don't use much of titanium.
So how does surgeries work? What is the extreme level that they require to have surgeries?
Yes, surgeries when conservative and bent bones cannot be treated by ordinary physical methods, exercises, tablets and other things. What we advise them is the pain still persists. Only when the conservative methods fail, we advise them surgery. Or if there is an sciatic pain, the nerves be compressed, which cannot be cured by tablets and exercises, the pressure cannot be relieved. The surgery has to intervene in that time, go there and then remove the small bit of bone which is causing pressure. The disc may cause pressure to the nerves, and that is the one causing to the sciatic to the limbs, pulling to the limbs, and numbness will come, sensation will go, even the bladder bowel control can also go.
Okay.
So to correct that, we remove the pressure effect. What is giving pressure there? That part of the bone or that part of the disc material will remove it. And if the bone is very weak or unstable, we will put the plate and screws to hold on. Stability, to give them stability, and we can make them to quick walk and other things can be started up very early as possible. Within a week's time, we can do that.
With regards to pressure, almost 6 out of every 10 male individuals push themselves to go to the gym. They lift heavy plates and weights. How does that affect that?
Yeah, that's it. We advise them, doing a physical exercise, best exercise is only walking. Till 40 years, you run and jump and jog, your bone will bear on, and that's disc and other sponges things inside can bear on the pressure. But as it goes on, 40 years, it will become more of stiff, like a bamboo. It will start gradually become, it will break. That can cause the ligaments cut itself, can cause a severe pain. And if the nerve is involved, the shooting pain. If the bone is fractured, you cannot walk. Okay. So all this will start. So what we advise, after 40 years, brisk walking is very good. And after 60 years, slow, steady, happy walking. After your food, after your dinner, mild walking for 1 or 2 kilometers, the best exercise to keep you trim and active and alert.
Okay, doctor. Is there any other nutrition or hormonal supplements that people can take to avoid these osteoblast conundrum?
So usually we don't recommend hormones. If the bone is very weak, we'll give them. If nowadays the the parathyroid has come, injection forms have come. We ask them to take 20 units per shot.
Okay.
So that can induce your bone formation and prevent the absorption from the bone. The calcium material will be pulled out. That can be stopped by these injections. Tablets, giving calcium tablets causes renal calculi. Can be stones in the bladder, in the stomach. So many things we see in the bladder and ureter. That is draining from the kidney. So to prevent, we minimize the tablet forms of calcium and give them injection form. That is just small. It's just like insulin needle, insulin pen. So just 1 shot every day that can stimulate the osteoblasts and keep on active. That keeps. I've seen after fracture patients, we do give that. That heals the fracture process, and they what takes 2-3 months, it will be 1 month, they'll be all right. Okay. So that is the best method to treat in that. Osteoblastic activity can be increased by that.
And is fracture a one-off time event, or is it due to continuous stress to the bones, doctor?
Yeah, that is known as stress fractures. Continuous stress to the bone can produce stress fractures. See, now you can see our cricketer Bumrah. What has happened? He is bowling so much of strain to his spinal bones, vertebral body, gives a crack. Not a fracture, crack fractures. Stress fractures, they are known as. Because if you take rest, it will become okay. But you can't be going on and on for 6 months, it will take. The stress fractures can occur in the spine, vertebral bodies. It can occur in the pubic bone. Okay. And other places can be even in the neck, tibia. The long runners, the soldiers, more common in policemen and soldiers, where they keep on running, jogging, stress to the upper part of the tibia. Yeah. That can cause a crack fracture. The main thing is you can walk, there won't be any pain, but you run or jog or put weight on that much, you will get the pain. So we advise them, take rest, take this if necessary anabolic steroids that will increase your bone strength. Bone matrix can be improved. Okay. So all that will put them better. Early healing, but the rest is the best. Minimum 3 to 6 weeks we give them rest.
Is there any proper prevention that people could follow, those who are strenuous runners, like you spoke of police and that? Is there any proper methods that they could maintain when they run or when they do any profuse activities?
That is, you have to steady your running. Suddenly don't increase your speed. Before 40 years, you can do this, running, jogging, stress and other things. If you find you are having slight pain in your leg, immediately go for that x-ray, but you can't see that stress fracture. That will minimum only when the fracture is well occurred. That white line will come. That will indicate that is healing. So that time you have to take a rest and good protein diets. Calcium intake should be more vegetables calcium, and animal calcium is more than enough. You can take that gradually, it will go on. Not any amount of calcium which you take, you won't get absorbed. It will be just going out in the motion. So take an injection form, take rest, not to strain. Do daily exercise, must. Gradual daily exercise is a good thing to be maintained. Good nutritious, protein rich diets, carbohydrate less, all that. And walking is the best exercise you can do. That's what way I advise.
Okay, doctor. And how can the working class differentiate between a chronic bone pain and a normal bone shock? Let's say like they just hit their patella on the table corners and that hurts. And is that any difference? How would you differentiate that from a proper patella pain, a small crack in the patella or something?
See, that is what you are asking is whether in the old age they get a pain in the patella, and because of the injury you can get a fracture. This is because we will ask them the history. How did it start? Okay. If he says it's because of the injury, we'll take an x-ray and see, and then give a knee belt or knee support. That with that he can walk about. Patella is not a weight bearing organ. Only 1/6 of the body weight goes there. So that is not much. Put a belt with a gauge there or support and ask them to do the work. If it's displaced, if it's injury, trauma induced fracture, so what you do is displaced means the quadriceps will get altered. Quadriceps muscles can be altered. He cannot keep his legs straight. He has to have a bent knee. So to avoid that, what we do is we will take an x-ray and see if it displaced much. We'll put a wiring.
Okay.
Patella can be united. What is displaced can be brought near, the fragments can be brought near, and a wiring can be done so that it will heal faster. Within 3 weeks it will be okay. do his quadriceps exercise, static and dynamic, start contracting. The football players will be doing, keeping on running and doing quadriceps. That is the best thing for the patella, I think. And mild tablets, analgesics if necessary to do it.
Okay, doctor. And also, in this day and age, almost everybody is working on the laptop with their mouses. Carpal tunnel seems to be a very common problem. And how does that carpal tunnel affect your bone health as well as your overall well-being?
Yeah, carpal tunnel comes in the wrist. This is because they keep on moving the mouse. So that is give rest and other things. The more of the thing the patients come to us is using the laptop is they have that neck pain.
Okay.
And constant sitting in one place, they have back pain. So that's what I've seen in the IT sectors. They'll have nearby table tennis board to go and play every 1 hour after that. Milk, big drum of milk and whatever you want, coffee, tea or some health drinks you want, it will be there. That is good. You work for some time, then relax and do these exercises, neck exercises. Keep it extended. What I tell them is, just lift up your laptops.
Okay.
Don't keep it down. See that you don't bend down. Keep your neck X. That is known as extension.
Okay.
Extending your neck. Lift up your neck and see. I always advise them, see 𝗏𝗏𝗃𝗃, how he is bending and neck erect. That is the posture you should maintain. The more you bend your neck, the more the ligament gets stretched and the pain comes faster because unnecessary strain to the ligament of the neck. So even in the spine also, you keep it straight. Don't keep on bending and doing the work. So take some rest. And as there in the corporate industries and all, go there, play some time, play some table tennis, have some little bit of milk, not heavy. You can increase your weight. So relax and exercise, mild walking. Or you can't do anything, your heart is okay. Climb up the steps up and down for 3-4 times and then come back and do your job. That will be good. If feeling hungry, have that milk and other things, mild biscuits. So that is how you should maintain.
Okay, doctor.
Living a life without pain is the excellent way of life.
Okay, doctor. One more thing. People with neck pains, especially the IT professionals, they use something called capsicum strips. These capsaicin-coated patches or bandages that they use. Do they work well or is it not advisable?
No, that is a counter irritant. See, that does not give the relief. See, we have that counter irritant in all analgesic and anti-inflammatory ointments. They have the counter irritant. The counter irritant is that the irritation will be see, you will be feeling the irritation. The pain stimulate, the pain thing will be less. You can't feel the pain, but irritation will be there. So the pain persists. It is there. But because of you feel more of irritation. So you will be seeing only the irritation, you won't feel the pain. So that is how that 𝗏𝗂𝐶𝐵 works. So all analgesics and other things and ointment, local applicant and liniment causes that counter irritation. That causes more. So you don't feel the stimuli for the pain is not seen. But the stimuli for the irritation is more. So you feel, oh, more is that. It's like 2 lines in Tamil, they say 𝗬𝗂𝗄𝗀. One small line, one big line. So the big line will be feeling, small line persists. So that is how it is counter irritant. 𝗏𝗂𝐶𝐵, it is time being relief, that's all.
Thank you, doctor, for taking your time and answering all my questions. We have more questions lined up for you, doctor. Stay tuned as the doctor answers more of our questions in the upcoming episodes.